Hello, my name's David Clay. Following yesterday's government announcement on the easing of some of the lockdown restrictions, we thought it was a good opportunity to talk once again with Dr. Nick Summerton. Dr. Summerton will be answering some questions posed by our readers. Today and last night, of course, the government have announced some easing of restrictions, which makes our questions today a little bit more relevant. So, Dr. Summerton, firstly, thank you for joining us.
Thank you very much.
And can I start off, please, by asking a question from one of our readers? This is from Samantha in Bingley, and I think this is one that will be very, very popular because of the announcements today. One that a lot of people will have been wondering: should the wearing of face masks in public actually be mandatory?
Well, I think, Samantha, I don't think we should be forced to wear face coverings or face masks, and the recent government guidance actually reflects this view. But they certainly might be helpful in certain situations where we're close to others, for example, in crowds, in shops, or on public transport. But it's a really, face masks and face coverings are really about protecting us from other people and protecting other people from us. So it's a sort of two-way process. And also, I think the important thing is we need to talk more about face coverings rather than face masks, because what we need to be careful is that we don't remove the supply from care homes or the NHS. So that's also important. So something about more something we can make ourselves is important. But first of all, I think we shouldn't be using face coverings or face masks at all in children under the age of 2. And if we use them ourselves, we need to make sure we wear them properly, and that means covering your mouth as well as the nose, and washing our hands very carefully before we put them on, and also after we take them off as well. Um, Many face coverings, we need to make sure we wash them after we've used them once, and ideally a hot wash. And we also, when we're wearing them, we need to make sure we don't touch it when it's on our face as well. I think the other thing to say about face masks is, or face coverings, we don't need to feel over safe if we're wearing one. And what I mean by that is we need to remember that we have to keep washing our hands, we have to keep our surfaces clean, not touch our eyes, we need to carry on doing the catching our sneezes and coughs, and we need to keep social distancing. And also, of course, isolating still at home if we've got symptoms or anybody in the family's got symptoms as well. So it's important that to remember they might have a role in certain situations, but we mustn't forget to do the other important underlying things as well, of focusing on hygiene. And if you do want to make one yourself, there's an awful lot of really good videos on the internet at the moment, about how you can do this, using pillowcases and the CDC and, I say, videos. There's a lot of information out there that might be helpful.
Okay, thank you very much for that. And the second question today is this is from Bruce in Harrogate, and he asks us: will we have to wait for a COVID-19 vaccine before my community centre can reopen?
Yeah, thank you, Bruce. This is a really important question. I mean, hopefully the answer is no, if things we keep on track as outlined by Boris Johnson, and hopefully we might be able to start seeing some opening in July if we keep on track. The important thing to realise is that some community centres can already open to host essential voluntary services, urgent public services such as food banks, homeless services, and blood donation. So many are not completely closed at the moment, but when we do reopen, hopefully before the vaccine, we'll need to be very careful about a number of issues. One of them will be, of course, maintaining social distancing, keeping 2 meters away from everybody as much as we possibly can, and taking care with hygiene, hand washing, hand gel, making that available, and again, catching coughs and sneezes, as we often say. And then also we've got to make sure we're scrupulous in cleaning door handles, buttons if there are any, and surfaces. Um, and of course, don't go if you or anyone in your household has any symptoms. And if you've got any underlying medical conditions or you're older, again, you need to take care, particular care when you're in environments where there might be numbers of other people. And I think those who run community centres might also need to think about doing things a little differently. We might need to think about one-way traffic in certain meetings and community centres. We might need to think about different exits and entrances if possible. I mean, face coverings again might be important. Perspex screens to separate people might have a role, and thinking about things like how we're going to use the toilet safely and how we might have refreshments or whether we shouldn't have refreshments. So there's lots of things to think about, but hopefully, if we can be careful and sensible, then in July it would be good to, I would expect to see some community centres opening.
Okay, moving on now. The next question here is from David in Menston. This is one about public transport. What should the rules surrounding social distancing be on trains?
I think this is a really difficult and important question, David, because I think the thing is we've got to try to maintain the 2 meter distance as much as possible, which means actually that there's going to be less people that can be carried on trains. And I think the trains are recognizing this. And many of us, most of us, will probably need to book ahead in order to make sure that we get seats. And train companies also need to think about how we can safely use communal areas like toilets and cafe areas, and they're going to have to focus on the regular cleaning of door handles and buttons, and again the use of screens, perfect screens, and many will probably encourage the use of face coverings, and again thinking about separate exits and entrances for people getting in and off trains. And for you and me, David, if we're going on trains, we need to think, well, do we need to really do this? Can we work from home if possible? Um, and can we do we can we find other ways to travel to places? Because if we can avoid public transport, especially if we're older or of underlying illnesses, I think it is wise. And certainly don't travel if you or anyone in your household has any symptoms. As with anything, you need to isolate at home. And also, you can think about when you should travel, and there are obviously quieter times and when you could travel as well. But I think if we do end up on a train, we're going to need to think about washing our hands, carrying hand gel, not touching our face, catching our coughs and sneezes as always, and taking particular care though in toilets, not touching anything, and taking our own food and drink. I think is going to become important, so that we don't end up having to, walk to a communal cafe area. And if you do talk to somebody on the train, talk to them side to side, because actually if you talk face to face it's much more risky than just talking from side to side. And of course face coverings as well are something that I think many people are going to be taking with them if they're on a train.
Okay, thanks for that. I mean, a very interesting point there about side to side talking. That's something that I've not heard mentioned before. A great tip, I think there. The next question is from Sheila in Doncaster. When do you think it will be safe to visit my gran in her care home?
Again, Sheila, this is such an important question for so many people, and but I think it's going to be very unlikely this will happen before July. The Prime Minister mentioned that the outbreak is particularly difficult in care homes and particularly bad in care homes at the moment. And this matters not just for the residents, obviously, but also for the community around that care home as well. And many residents, of course, are particularly vulnerable, and many are shielding as well. So it's a tricky situation. But I think one thing that we were looking for was more testing, not only of people with symptoms, but also for all residents and all staff. And in the Prime Minister's announcement, he's undertaken that everybody will now be offered testing by June the 6th. So that's an important date to keep in mind. June the 6th, every member of staff, every resident in every care home should be offered testing. The other undertaking he's made is going to be more personal protective equipment and much and more better information about infection prevention and advice. So this has all been announced now and promised by the Prime Minister. And really, this is all about helping the fantastic care home staff to get things under control, because they are in probably the most difficult situation they are at the moment. But I think in terms of your gran, I think all care homes, of course, are different, and some have more cases than others. So what I would say is things look like they hopefully will get onto the right track now, but it's important to keep checking with the staff every week about how progress is being made. And July may be where we get to. If things go well, it might be before that. But as I say, things are going in the right direction, or they're promised to go in the right direction, and we can hopefully look for things to improve with the testing being ramped up by June the 6th.
Okay, now the final question here, a bit of an unpleasant one really. Stuart from Leeds asks you, what are the risks associated with spitting, and actually should it just be criminalised?
Yeah, Stuart, this is a tricky question. I had to do a bit of work on this one actually as well to find a bit more out about it. I mean, there's no doubt that spitting, in some ways, is something that we all have to do from time to time. If we swallow an insect when we're out cycling or walking, obviously, it's inevitable that all of us will have to spit something out from time to time. But regular spitting is seen by many as antisocial behaviour, and there's no doubt saliva can spread tuberculosis, hepatitis, and now, of course, coronavirus as well. And actually, up until 1990, it was an offence with a £5 fine for spitting. And that seems to have lapsed. But recently, some councils, particularly Enfield Council in London and Waltham Forest Council, have developed bylaws to dissuade people from spitting with £80 fines. And I think that's something that certainly needs to be looked at again. This sort of idea of the sort of an antisocial element of regular spitting, but there's a separate bit of spitting as well, and that's the intentional spitting. When you're there in front of a police officer, or in casualty in the hospital, and you spit at somebody with an intention of doing them harm. Now that's a crime already, under common assault and battery under the Criminal Justice Act 1988. But I think the problem with that is sentences still seem to be quite moderate, mostly a fine or a community order. And the Home Secretary, I know, is looking at hardening this up, especially if it relates to an emergency worker. So I think, in short, I agree with Stuart that for public health reasons, the law should be used to bear down on all spitting, whether it's just common antisocial type spitting or intentional spitting. So yeah, I think it's a very good question.
Okay, well, thank you, Dr. Summerton, for speaking to us this afternoon, and thank you to our readers for firing in those interesting questions. It's been a great chat with you again. Thank you very much indeed for coming on the programme.
Thank you very much for inviting me. It's been a pleasure.
Well, that was Dr. Nick Summerton answering some of our readers' questions about the coronavirus crisis. Hope you enjoyed it. Join us again next time. I'm David Clay.